No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. In this fourth and final episode on psoriasis, we look at clinically supported lifestyle correction in psoriasis care. In the first three episodes, we looked at the causes of psoriasis, the latest and current treatments available for psoriasis, the comorbidities and complications of psoriasis. So here we begin with clinically supported lifestyle correction for psoriasis. To begin with, Dr. Jolly, what exactly is lifestyle correction when clinically supported as compared with saying eat better or exercise better or do so many things that you can better?
The difference between the clinically supported lifestyle correction and the regular lifestyle correction. In conventional lifestyle correction means the people with our own understanding or one's own understanding, they are trying to correct it. And everyone knows that if some exercise is needed, they'll go to a gym or go for swimming. And for the food habits changing, they'll approach a lifestyle, approach usually a dietitian. And in many of the hospital, there'll be a dietitian, and also if the problems are severe, they will be going for a physiotherapist for specialized exercises also. So that is the usual norm. In clinically supported lifestyle correction, what I am following, in that we initially itself, we try to understand the health status of the patient and the disease status of the patient, not only from the symptomatic and also from the investigation point of view. The disease, the psoriasis is there. Psoriasis is now we are discussing on the psoriasis. When we think of psoriasis, psoriasis is not just a skin disease for me. Basically, it is an autoimmune disease. Your immune system is under stress. So it can, this immune system, one immune system is all over the body. It is the immune system. It is functioning in the brain and every part of the body. At a cellular level, it is functioning. So we had to find out the reason for the stress of the immune system. And the psoriatic patients will not be having the psoriasis alone. Other problem, there will be anxiety, stress, usually overweight, obesity. Or if it is a long-term medication, they may be having diabetes, hypertension, depends on if it is after the older age diabetes, hypertension, all these metabolic problems also will be there. So we'll be first assessing what is the current condition of the body, the inflammatory status, and also the body composition. What is the body composition? Generally, we as medically talk is lean mass fat mass ratio. The fat is very, very important in this. This fat, actually, the maximum amount of fat, it should be around 15 to 25. 15% in the, ideally it should be 15% for the male and the 25% for the female. But for most of the disease patients, the fat level will be very high. And the type of fat which is in the body also, in the body and also in our food. And if you are eating so much of omega-6 fat or the trans fat or this hydrogenated fat, the inflammation level will go high. So if the excess fat is, that also it's very important, and to reduce those, that is all considered as toxins. Body itself is considering them as a toxin, so it has to be get rid of from our body. And in that way, we will be following it up with the inflammatory markers, the ASR, CRP, HSCRP, and other diseases if anything is there, or any autoimmune antibodies are increased. So we are following it up with the correcting the lifestyle in a systematic and way. The optimal, basically the simple mechanism of the correction, what is needed for a lifestyle correction is, one is the nutrition should be optimal nutrition, then is optimal exercise. The exercise in the correct way, not too, both this should not be too little or too excess. That is the most important. Next is the toxins. Reduce the toxin intake through the food and the air and water. You have to try to reduce. This PET bottles, if it is kept in the sun, and it will be having so much of toxins. Everyone knows it. And also nowadays we are taking the food, which is instant delivery system. They are all packing the hot food in the plastic containers. So many toxins, extra toxins. And also, when you are taking food from outside, so much of color, preservatives, and the sauce, all these sauces are all mixed with so many of the flavoring and coloring agents. So all these toxins you are taking into your body. So you have to reduce that. You have to cut off this these food additives. Eat fresh food. Even this processed food means this processing is if it is reducing the nutrition and also the adding the this preservatives. So such things has to be avoided. And giving a protocol for with a simple protocol for those things, if you are able to follow, and all these things, the correct nutrition, this thing, and also the mental and physical rest, enough sleep. If all these parameters are corrected, then it will be very easy. That is the difference between, and it is in a scientific and systematic and evidence-based way. Then that is actually clinically supported lifestyle correction.
From what I heard, what we understand is general lifestyle correction means what someone is able to do on one's own with one's own knowledge and all that. But clinically supported lifestyle correction means you're actually making your food, your activity, your sleep, you're making each of these actually act like medicine for your disorder. So that is the sharp focus of this approach. Actually, when you are looking at patients who are suffering from psoriasis, some of them may be at the beginning stage, some of them must be, suffering for long and having all sorts of other complications and comorbidities and all that. Which are the patients? Can you think of that? Who benefit most from this clinically supported lifestyle correction?
See, everyone, if they are willing for a lifestyle correction, they'll be getting benefit. If you're a beginner, if you are not gone for so many medications like methotrexate, because that is actually harming your body. Many of these immunosuppressants, and in long term, if you are taken steroids for a long time, you will be having associated diseases also. Basically, the most benefited will be the most suffering. Too many diseases are there. Actually, if the psoriasis alone is there, definitely psoriasis can be easily overcome. But the others who are suffering it for a long time and taking medication and associated comorbidities like diabetes, hypertension, etc., also is part of it. They are also much more benefiting, because we are always thinking in terms of this commercial activity, this sort of thing. So they'll be getting three diseases are there like diabetes, hypertension, and psoriasis. They're getting out of this all the three diseases. That is the advantage of this lifestyle correction. We are not, the sun is giving light to everyone. So if you're sitting in the home, you won't get it. But if you're going out and getting fresh light, that is, you are getting it. So just like that, when you are giving the clinically supported lifestyle correction, you are giving nutrition for all your cells. At the cellular level, we are trying to give it. That is why it is called a cell activation protocol. And you are giving stimulation for all the cells in the trying to give stimulating all the cells in our body, and also to remove all toxins from your body and preventing the more toxins to come inside. So the benefit will be to all the cells in the body and giving rest. Actually, the immune system is actually actively functioning during the sleep and the rest time, especially during the sleep. So proper sleep, all the cells in your body, not only the skin is getting benefit, all the cells in your body is getting benefited. So that is the value of this clinically supported lifestyle correction. You are understanding. Actually, it is not more than a treatment, it is a teaching course. You are, with the support, you are trying to understand. With the professional expertise and the support, you are learning how to manage your body in a most efficient way. Which food is most efficient for you, how much you can eat, how much is excess for you. It also will be different for you. We are all thinking that this general teaching in the medical science also, you need an average medium activity 2500 or 2000 calories per day, and such things are there. But it is not really functioning. With my experience, I'm telling, some people doesn't need much of the calorie at all. So that is why they are even the same, two people eating the same, but one will be keeping lean, but the other is getting over obesity is with it. That is depends on your metabolism also. It depends on your cellular metabolism, even the mitochondria. That is that is actually the powerhouse of your body. That also is very different in different people. So you have to learn that and adjust according to your body specification. Then you can, that is actually teaching you how to, and by following with the test and all. It's basically everything in the modern medicine should be evidence based. So we are actually following it with the even day-to-day follow-up over the digitally, and initially in the weekly follow-up and the testing, and then monthly, and even from the different distant overseas patient or distant country, also we will be able to follow in the correct manner, and they are also able to manage and get out of this lifestyle diseases and out of medication also. That is the most important. If you are taking medicine, then you are a sick patient, even though you are controlling. And many patients, there is psoriatic patients say, doctor, I am having this diabetes and hypertension and cholesterol and all that. I'm not bothered about that. It is okay with my medicine. I can take that medicine, but I want the psoriasis to go. My skin has to problem. It is so much itching and discomfort. So you cannot treat psoriasis alone. You have to treat the diabetes and hypertension also along with that. So diabetes blood sugar control, we can, if it is correctly following the instructions within 24 hours to 48 hours, you can get the blood sugar control without any medication if it is a type 2 diabetes. So excess glucose is also a toxin. So we have to come out of all these toxins, toxic exposure to be reduced.
Actually, when we are talking about treatment of psoriasis, many a time, the feeling is, if I can do something that will make an immediate visible improvement, there is nothing better than that. So the general feeling is there may be medications which may be able to give an immediate difference. But regarding clinically supported lifestyle correction, what are the possibilities of getting quick relief?
For the quick relief, for the psoriasis patient, immunosuppression is the best way of doing it. Basically, say the modern medicine, anti-inflammatory agent and immunosuppressants are very effective for immediate result. For the lifestyle correction also, the result is very fast actually. But if the patient is symptomatic, like a pain or this exfoliation, etc., itching and all, we give light immunosuppressant like dexamethasone or some local applicants steroids for the initial few days. And also if the psoriatic arthritis is there, NSAID group of medication also can be used. And what we do is actually stay for the same symptomatic relief, give medicine, and then within a week or so, that immune system will start acting. Actually, the most beautiful thing in the immune system is this immune system cells have a lifespan only for 4 or 5 days, and if it's a diseased condition, it is maximum 7 days, and in diseased condition only 3 or 4 days. And when you give optimal nutrition and the toxins are reduced, the immune system will get corrected and the repair activities will get corrected, and most of the patients will get a relief within a week. Then you can taper off the medicines. But if I am giving something, some anti-inflammatory, actually all of the medicines in the modern medicine which is used is anti-inflammatory. The steroids and all the medicines actually, and the painkillers and the fever reducing agents and everything is actually anti-inflammatory medicines. And then you are tapering off that medicine. And also if the patient is taking other medication from the older prescriptions, maybe for a long time there will be medicines. So that also will be tapered off gradually with showing with monitoring the symptomatic relief. And also for the skin psoriasis, we can see evidently on the skin, and also follow with the anti-inflammatory markers in the blood also. Now, another important thing is if the patient is having this diabetes, and patient may be on insulin and some other anti-diabetic medicines also, that in the type 2 diabetes, we stop the diabetic medicine the first day itself. And the patient is following correctly within 24 to 48 hours, the blood sugar will be within control also. So you are eliminating that toxins also. That is, the medication is also the body for the immune system, that also is overburdened. So that also is getting reduced. So depends on the patient's condition. Within 1 to 3 months, we will be able to get out of all the medicines. Even those on high this methotrexate and all. Methotrexate also will be, so if it is 20 milligram, initially we reduced every weekly. If the symptoms is okay, we reduce to 15 milligram, 10 milligram, then 7.5, 5 grams. And likewise, we reduce the gradually withdrawing. Only the diabetic medicine for the type 2 diabetes, immediate tapering off. Because we can see the blood sugar within 2 hours itself, we can see the result. So everything is what is the clinically supported lifestyle correction, the evidence-based, and the symptomatic and the blood report, and everything is following in the most efficient way. We are using all the modern medical amenities in the most efficient way. Even if you want symptomatic relief medication, also we use it, then gradually withdraw it.
Actually, can you give an example of a case where this clinically supported lifestyle correction has made a remarkable improvement in a psoriatic patient in a very short time, surprising the patient himself?
Actually, each patient is a surprise for me, and also most of the patients also, because after seeing, or maybe this sort of videos seeing, then they are coming to me. And they, especially when in the social media, they will not be believing it in that exactly. But they may be, anyway, will also, anyway, I'm suffering a lot and trying all these measures. And this may be giving me a result. That maybe most of the patients will be thinking like that also. Because wherever you look, in the this medical literature and all, this sort of thing is not anywhere. So when we see, I have also seen many patients who are very severely affected psoriasis, severe affected. Even this, all this yellowish, this pustular psoriasis is the most difficult actually, and this pustular psoriasis, and itching, heavily itching, and other, along with that, other diseases also. Blood sugar control is not there, and there may be, and the sleep is not affected, and the husband may be complaining of I'll tell you an example. Actually, this patient, she's suffering from psoriasis for a long time, and she is diabetic, and actually she has a corneal ulceration also. She's under the care of an ophthalmologist for the ophthalmology consultation. Actually, she's gone to a very famous ophthalmology center for this eye problem. And this is taking treatment for this arthritis, psoriatic arthritis also is there, and the rheumatology care is there. And finally, the rheumatologist has advised her to take she's on methotrexate and the insulin, daily dose of insulin. I don't remember what all medicines, and diabetes, hypertension, everything is there actually. And the rheumatologist has asked for this Thomson, some monoclonal antibodies, which is costing around 50,000 rupees in Indian value, 50,000 rupees for a single injection, and she may be needing weekly or monthly injection, initially weekly and then monthly injection or something she has was advised. And in that stage, she is coming to me. And when we start this treatment, actually it is the calorie, it's what we are support nutrient food is a low calorie. This the carbohydrate and also the saturated fat is very low. The omega-3 and all the nutrients and the dietary fiber and all will be in the optimal value, it will be there. So with that food, within a day, her diabetes, insulin stopped in the first day itself, diabetes is controlled, and the symptomatic relief is there, painkillers and all. Initially, if I don't remember exactly whether she was on painkillers, but if the pain is there, we'll give light painkillers. Within a month, she was able to come out of all the medications actually. Except she was using the steroid dose for her corneal ulcer. Actually, she was advised for cornea. If she has to, it's almost gone that vision. And when looking also, this opacity was there very visually, and some sediments in you can see there's some level of sediments inside the eye also. So I also told her, I don't know whether it's a vision, and at least when you come out of all these problems and diabetes and everything is over, you can think of a corneal transplant. Otherwise, in this stage with the diabetes and this active status, if you go for a corneal transplant also, it may not be successful. So, and actually within 3 months, her this eye drops, that initial all the oral medicines and the diabetic medicines, everything is over, and the the psoriatic problem, arthritis, everything is over within a month itself. But she was continuing. I was not confident to stop this steroid drops. Then we gradually reduced the number of steroid drops from the in the eye, and her vision also is completely recovered. And there is only some little opacity in the outer part of that initially that the cornea was actually this edematous and opacity was there, but only the outer part there is some scarring was there. Otherwise, her vision was also restored. So that is actually, I never thought that that will be possible. Where the restoring her vision, I was never hopeful about. But that also was possible. Otherwise, the diabetes and hypertension and psoriasis, it's so many patients we are seeing and getting result. But this corneal ulceration and uveitis, it's not only corneal ulceration, uveitis also was there. That is why there is pustles inside, that there's just a level of sediments inside. That also cleared. That is actually very satisfying. And it's just very surprise for me also.
That example was incredibly powerful and definitely satisfying to you. In this episode, we have been seeing how clinically supported lifestyle correction can make changes in the lives of psoriatic patients. From what Dr. Jolly often says, from being a passive patient to becoming an active healer is what every patient should hope for. So that is, I think, in a way illustrated in the talk of this 4-part episode on psoriasis. Thank you all for being with us in this 4-part series on psoriasis, and welcome to more videos on lifestyle disease doctor. Thank you.